Hello, you guys, and we are here with Tuesday/Thursday tips. Sorry about Tuesday, it was a busy day in the OR. Sometimes that happens, but we're here today and we're going to be talking about breast augmentation. Breast augmentation, how we put the implant and where to put the implant. So we're going to focus in those two things and then I'll get to answer your questions, okay? So how to put the implant is where are the incisions. There are multiple access points to put an implant in the breast. Depends on the patient's wishes, but also the anatomy, and there's some of it surgeon preference as well. So I'll let you know what are the options or what are the incisions out there, which one is the one that I usually use and why I don't or usually don't use the other options. So the two most common are in the areola or periareolar, and the IMF or in the fold. This stands for inframammary fold. Okay, those are the two most common incision approaches for a breast augmentation. The periareolar is very popular because the scar tends to heal very well. The change in pigmentation from the areola to the normal skin hides the scar very well, so it's a good access point. And the IMF, it may be a little bit more noticeable if you're wearing a very tiny or small bikini or without clothing. But if you're putting a fair amount of volume in the implant, it actually hides very well in the fold. What is my preferred incision? It's usually IMF, actually, the inframammary fold incision, and I'll let you know why. The problem with the periareolar is when we're going through the areola, there are ducts there, breast ducts, which carry bacteria as any duct or any mucosa in our body. When we're talking about ducts, when we're talking about breast augmentation, we try to make the surgery as sterile as possible because we're putting a foreign body, an implant. So whenever we're doing an implant, the risk of infection is higher and the risk of capsular contracture is there, which we want to minimize as much as possible. So with a periareolar, because we're cutting through the breast ducts, the risk of infection is a little bit higher. The risk of capsular contracture is a little bit higher. What is capsular contracture? Capsular contracture is the scar tissue that forms around the implant, which is the capsule. Everybody has that. Everybody that has implants in their body, not only breast implants, any type of foreign body, our body reacts or creates scar tissue around it, so a capsule. In breast implants, when this capsule becomes symptomatic, thicker, painful, harder, then we call that capsular contracture. So the risk of capsular contracture, it's around 5 to 6% in breast augmentation and breast implant surgery. But what things we do to try to decrease that as much as possible? One of them is the access point. So when we're comparing the two most common, the IMF has a less risk of capsular contracture and has to do because I'm not cutting any ducts. I'm going straight under the breast tissue, leaving the breast tissue up and putting the implant, not cutting through any breast tissue, not cutting any breast ducts, okay? So that's why I prefer IMF. Risk of infection is lower, risk of capsular contracture is lower too. And if you're planning on breastfeeding in the future and we stay away from the areola and breast ducts, the odds that you'll have problems with breastfeeding is even lower. So breastfeeding is, and breast implants not a contraindication for breastfeeding. The majority of people with breast implants can breastfeed, but if you do a periareolar, you may have more scar tissue around the ducts, which may affect your ability to breastfeed, okay? The other thing to consider is the position. So when we are doing the pocket or creating that space is not there, right? We're creating surgically this space to put the implant in, okay? When we're doing it through the areola or through the IMF, we're creating this space directly. I can visualize it. If it bleeds, anything, I am there visualizing and creating that pocket exactly where I want it, so the breast implant has a better aesthetic result and position in your chest. When we're going away, trying to put this implant from other areas, which are either the axilla or the belly button, we don't have really a control of that pocket. So the risk of malposition or asymmetries, one higher, one more lateral than the other, is higher when we go through the axilla and umbilicus. And that is why I don't like to do these approaches for breast augmentation. The risk of infections is higher because the axilla and the belly button are not clean places, are very dirty places. So the risk of infection, capsular contracture is very high, and the risk of malposition is very high. So these two, unfortunately, they seem to be very great options. I can put an implant and have no scars in my breast. Well, the reality of it is that the risk of infection is higher, risk of capsular contracture is higher, and the risk of having asymmetries is higher. So I don't like to do it. I do these two approaches for breast augmentation the majority of the time in the fold to decrease infection capsular contracture rate, okay? So we talked about the how. Where do we put the implant? So there are 4 places we can put the implant. You're like, what? We're putting it in the breast. What are you talking about? Well, different layers. So let's talk about the layers. We have the skin and breast tissue. Under the breast tissue, we have the muscle. But covering that muscle, we have something called a fascia. All of our muscles have this. It's a thick coverage of the muscle that is actually a very strong layer, okay? And then we have the chest wall, okay? So we're putting the implant in we can put the implant in different layers, and there is some advantages and disadvantages of each one, okay? So the most common is under the muscle, okay? Still, the majority of surgeons place the implant under the muscle, and it's actually a good position to place it, but whenever we're elevating the muscle, there is more pain and risk of what's called animation deformity. What is that? When you move your arm, because the implant is under the muscle, it animates, so it may move with your arm movement. If you are more athletic, you work out, especially upper body, if you're a swimmer, if you are a gymnast, then your risk of animation deformity is more because your pec muscle is thicker, okay? So if that's the case, then it's better to put it over the muscle, okay? I do, the majority of my breast augmentations is either subfascial or dual plane. Dual plane is under the muscle, but we elevate the muscle half the way up. So the implant is actually in below the muscle in the superior part, but below the breast tissue on the inferior part. So if you're looking yourself on the side, if this is your chest wall, the pectoralis muscle is elevated halfway, and then you have your breast tissue here, and you put the implant here. So at the top is covered by the muscle, at the bottom is covered by the breast tissue. And that is called dual plane, okay? 2 planes. It's actually a good position to put it on because, one, you have the support of the muscle, so that gives you an extra strength to hold the capsule and the implant in place. But the risk of animation deformity is less because the muscle is released from the bottom and it's not pulling it up, okay? So muscular means under the muscle completely. I don't do that because the risk of animation deformity is too high and it tends to hide very high. So I either use subfascial or dual plane. If you have no ptosis or no droopiness at all, you have breasts that are very, very perky, then there's no need to put it under the muscle. I got subfascial, less pain and less risk of animation deformity. If there is a little droopiness and we have to put an implant a little bit bigger, then it's better to put it in the dual plane. That way we have more support of the muscle and less risk of having droopiness or what it's called double bubble deformity, which is the implant laying high and the breast tissue low. And you can actually see like 2 areas, the implant high and the breast tissue low. When we put it in the dual plane, that's less risk of that happening, okay? So those are the positions and those are the incisions. So let's have some questions now.
Hey! Okay. If I'm 34 double D and only getting a lift, would my breast still sag?
So no. So a breast lift corrects the sagginess, okay? So when we're talking about sagging breast, that's called breastosis or droopiness. The way that we describe that is the position of the nipple in comparison to the fold, to the inframammary fold, okay? When we're doing a breast lift, we're reshaping the breast so the breast tissue is above the fold and the nipple height lies above the fold in the center of the breast mound, okay? And that's a breast lift, right? Sagginess or droopiness does not mean the shape of the breast, okay? And that is something sometimes it's hard to understand. So with a breast lift, it'll be lifted, it'll be perkier, and it won't be saggy because the breast tissue will be above the fold, but the shape of the breast is not going to be like a push-up bra look, okay? The breast will take the natural shape of the breast, just a little bit flatter on top and rounder at the bottom, okay? That's the natural shape of the breast. If you want to keep that push-up bra look, then you may consider adding an implant later on, okay? But with a breast lift, the sagginess and droopiness is corrected.
How to choose the correct size and type of implant?
It's a very good question. I have a good video about how to pick an implant, and I go into a lot of details about the profiles, the type of gel, if you're choosing a silicone gel, the sizes, the measurements. But what helps if you're getting a breast augmentation, you're going for a consultation, one of the things that is very important is your measurements. So that's why we don't talk about sizes when we're talking in a virtual consultation. I do it when you're here because I have to measure you, okay? And the other thing is the shape of the breast that you like, your goal, okay? So if you bring pictures, that helps a lot, okay? Because sometimes people tell me, oh, a very natural look, but what you're showing me, it's something different than what I think it's natural, right? So if you bring pictures, this is the look that I like, and these are my measurements, then we can choose an implant that's good and right for you.
Okay, next one. Let's keep... Okay, can you give me some advices on fajas? What kind of faja is best after mommy makeover?
Excellent. So yeah, fajas are extremely important. The compression garments, it's important to use it strictly 23 hours a day for the first 6 weeks. And from 6 weeks to 3 months, you can lower it to 12 hours a day. But they're extremely helpful to have the skin retract, avoid fluid buildups like seromas, and shaping the body. With a mommy makeover, because of the drains initially, you're going to be wearing a binder. It's like a wraparound with a Velcro. Once the drains are removed, usually that's 2 to 3 weeks after surgery, then is when you can start using the faja. The faja you're going to use for that should be a stage 2 at that point because you're going to be 2 weeks at least post-op. If you're still 1 week, you may have to start with a stage 1, okay? But by that time, you can start with a stage 2, which is a high compression garment, okay? What faja, it should be one that covers the entire torso. And if it has a little bit of leg length in the thighs, is better to get good compression in the thighs. If you get a faja that just compresses up to here, you'll see that the swelling starts to build up in your hips, okay? So that's the importance of trying to get a garment that evenly compresses up to the hips and tries to contour the body better.
Great. Is an ab board needed post BBL surgery?
Not needed, but helpful depending on your skin quality. Ab boards are very good for patients with mild to moderate skin laxity because the ab board gives you a more stable torso and avoids the wrinkling that forms when you're bending and walking, okay? The ab board creates that stretching of the skin so you're more stable and avoids those creases from forming, okay? You won't use it for the first few days. I usually advise to wait at least a week or 2 before starting the ab boards to try to get all that initial swelling to go down, and then you can start using the ab board.
Okay. When you do lipo, is there any way to be gentle? Those lipo cause a lot of itching afterwards.
So the itching is actually not related to how aggressive or rough you are with the liposuction. It has to do with the nerve endings, okay? So remember liposuction, I am thinning the layer from the skin and the muscle, the subcutaneous space. I am thinning that layer, and all the sensation to the skin, all those nerves go from the muscle through the skin, through the subcutaneous plane. So when I'm doing the liposuction and emptying that, I'm actually affecting those nerve endings. That at first you're gonna feel very numb. You're gonna feel numb all your skin. And once that starts to heal, the healing manifests as itching. So that's why it feels so itchy. And it's actually a good thing. It means you're healing, but it can get a little bit overwhelming, especially at night. So Benadryl, warm, like a warm bath help or shower helps a lot to ease that pain.
Okay, I'm getting a BBL with you on August.
Awesome.
Are you able to add a lot of projection around in a round number 1?
Depends on the skin. So everybody's different, especially on a round 1. The limit of how much projection you can do on a round 1 is your skin. So the skin needs to expand. It's like a balloon, right? You put water or air in a balloon and it reaches a max amount of stretch. And that's what happens in the skin of the buttock and hips. When you go to round 2, you've let that skin stretched out and heal with time. That by the time that we go for a second round, then you can go ahead and stretch it more, okay? So that's the limit. It's something that I can max it out or apply or put the max amount of fat in the area. But the other thing that's important to understand is if I continue to eject and the skin gets its limit, it stops expanding, what the body will do, it's kind of spread the fat up and down. The fat will go somewhere, right? If the skin is not stretching out more, then it's going to start to build up higher and lower in the buttock and hips, which creates a square butt, okay? So that's why I prefer to preserve the shape and max out, but keeping the shape rather than maxing out and continue to inject and create a more projected but square butt.
Okay, and this one en español. Hola, buenos días. ¿Cuánto tarda la recuperación de un mommy makeover?
El mommy makeover, como es una combinación de cirugía de seno y de la abdominoplastia, la recuperación más difícil o más que requiere más ayuda va a ser las primeras 2 semanas. Vas a tener 2 drenajes por la abdominoplastia. Esos drenajes se quedan usualmente entre 2 y 3 semanas, ¿ok? So, la mayoría de los pacientes pueden retornar a su trabajo y hacer la mayoría de las actividades del diario vivir en las primeras 2 a 3 semanas, pero con las restricciones de no levantar cosas pesadas más de 10 libras y no hacer ejercicios. Esas 2 restricciones son todavía hasta las 6 semanas, ¿ok? Estamos. Thank you so much, you guys. I'll see you Tuesday next week, hopefully, or Thursday, whenever, but hopefully Tuesday next week with Tuesday Tips. Thank you for joining.
And tomorrow we have the private live.
Right. Thank you, Willie. He's like my guardian angel here. So tomorrow we're going to be having a Zoom talk about labiaplasty. Labiaplasty is a topic that is a little bit more sensitive, and I understand that doing a live is not as private, so I did a more private setting. It's via Zoom, so if you're interested, DM me your email, and you're still, I can include you in this talk. We'll talk mainly about labiaplasty, but also if you have any other questions about any other procedure, we can discuss it and answer your questions in a more individual one-on-one talk, okay? So thank you for all the ones that already send us your emails, and I'll see you then. And if you're interested, send me your email, and I'll see you tomorrow.